Hello everyone and welcome to tonight's webinar on pathology e-ordering and My Health Record. My name is Alaouie and I am a pharmacist and digital health coordinator here at Sydney North Health Network. And I'd like to thank you for taking the time to joining us, for attending and being here this evening with us. So before we begin, I'd just like to acknowledge Australia's Aboriginal people as the custodians of this land. We pay respect and recognise their unique cultures and customs and honour their elders past, present and future, and extend that respect to Aboriginal people attending tonight. So just some housekeeping rules before we get started. So your microphone and video will be disabled during this webinar. We also would love to hear from you tonight. So please use the Q&A option at the bottom of your screen to ask any questions and send comments to our panelists. It is also possible for you to interact with one another. So you can do that by using the chat function below. Also, if your screen freezes, it could be that your Wi-Fi connection is limited. So just try moving a little closer to your Wi-Fi router. Also, at the end of the webinar, there will be a short evaluation, if you could also please complete that. So just running through what we'll be going through this evening. So I'll be giving a short introduction to the digital health team here at Sydney North Health Network. And then we will move into a presentation from the Australian Digital Health Agency, just going through the pathology ordering and a general overview of the My Health Record. And then joining us this evening as well is Douglas Hanley-Moyer, Sharlene, and she'll be showing us a demonstration of how pathology e-ordering works within best practice and medical director. And then we'll have a Q&A session at the end. So just before I do hand over to Summer, I just like to take the opportunity to inform you a bit about what the digital health team do at Sydney North Health Network and how we could support you and your practice. So we essentially provide free support to health services and healthcare professionals like yourself relating to digital health systems. So some of the digital health solutions we provide support and training with include telehealth. So we are still continuing to register practices and healthcare providers with a government-funded platform called Health Direct Video Call. We also provide support with the My Health Record, which is an online summary of your patient's key health information. We also provide support with secure messaging and also electronic prescriptions. Just on the note of electronic prescriptions, so we do have now over 92% of pharmacies in our region that are enabled for electronic prescriptions, and we are continuing to support general practices as well to enable that as well. So if you would like any support on any of the systems that I've mentioned just earlier, feel free to reach out and send an email to the digital health team. Their contact details are at the bottom of the slide there, and someone will be in contact to provide you that support as well. So really welcome to anyone who has just joined. I will now hand over to Summer for this evening's presentation. So just a little background, Summer is a registered pharmacist and an adoption and clinical use lead at the Australian Digital Health Agency, and she has over 10 years experience working in the healthcare industry. So over to you, Summer. Thank you.
Thank you so much, Aya, and hi to everyone joining us this evening. I'll just share my screen. There we go. Okay, so we'll just get started. We'll be looking at My Health Record and pathology electronic requesting, otherwise referred to as e-requesting or e-ordering. So firstly, just to tell you a little bit about the Australian Digital Health Agency. So we're focused on the implementation of digital health technologies to help improve health outcomes for Australians. And the National Digital Health Strategy is pretty much our roadmap for delivering on this project. The strategy has been co-designed in consultation with the Australian public as well as the healthcare providers, and it outlines 7 priority areas that you can see on the screen. My Health Record being one of the components of the strategy, and it's pretty much the concept is about having key health information available whenever it is needed. So as we all know, across the different healthcare settings in the healthcare industry, there's lots of different information systems, and there's information held within all of these systems, but the information isn't necessarily shared. And that's what the concept is, just to have this information that's going to be shared, and having this increased accessibility to information is overall to help improve patient healthcare. Okay, so as Aya mentioned before, My Health Record is an online summary of an individual's key health information. So we do stress it is a summary. It's not a complete record. It's not designed to be used as a sole source of information, but it's there to complement current records that will exist in a local system in a healthcare setting. And the great thing about the My Health Record is that it is personally controlled. So this is a key element of the system. So it's up to an individual whether or not they have a My Health Record, as well as what's in the record and who can have access to their record. There's certain codes, access codes they can set to their record. So we have what's referred to as a limited document access code, where just certain documents are restricted. And then there's a record access code where they can restrict access to their whole record. And then it's just a matter of them providing the access code to their health provider of choice. And then that health provider will immediately have access to the health information, and they won't have to request that code each time. Once they've been given the code the first time, they automatically go on what's called a provider access list. And then, so they are able to view all the information within the person's My Health Record. So also the My Health Record is part of a national system and it's accessible at all times. So these are also really crucial elements. So a patient's health information will follow them wherever they are. They can be traveling, or they can just simply be away from home and not able to get to their regular healthcare provider. So by having this information easily accessible at all times, it just removes the anxiety of them having to recall their medical history or medications to someone else. And also, just for some people, it's a difficulty just because of their conditions, like if it's an Alzheimer patient or someone from a culturally linguistic diverse background. So that's great to have the information that can be accessed anytime. And just keeping in mind the nature of the information that's held within a person's My Health Record. So it's quite sensitive information. So we do want to protect the integrity of that information. We do have very strong privacy and security mechanisms surrounding the system. And there's also legislation that's specific to My Health Record, and that's the My Health Record Act. So any misuse of the system is associated with significant penalties. Also, in regards to the security of the system, at the Australian Digital Health Agency, we have a cyber security centre, and this monitors the system 24/7. And all instances of access to the system are monitored and logged. And also, not just any system can connect to the My Health Record system. There's a conformance process that needs to happen before it is allowed to connect. So just having a look at some stats. So as of, these are from March, there's more than 22.9 million Australians that have a My Health Record. So that's about 9 in 10, and about 89% of these records have data in them. So the amount of data within the record can vary. So it is, the aim is to hopefully build this data over time. But again, this will depend on the patient's sort of how complex their medical conditions are and how many healthcare providers are involved in their care. Within My Health Record, there's been more than 2.7 billion documents that have been uploaded. So that's been a combined effort. So we've got over 100 million clinical documents, and that's from pathology providers, from hospitals. We also have medicine documents, and that's coming from pharmacies and general practitioners, as well as Medicare documents, and also consumer documents. So as I said, it's personally controlled. A consumer can also enter in personal health summaries, personal notes, and as well as advanced care planning information. And that makes up a good amount of the information that's within a My Health Record. In terms of engagement as well, the statistics are quite promising. So we have 99% of GPs that are registered with 99% of the pharmacies are registered with 93% that are actively using the system. In terms of primary care GPs, we have 97% registration and 88% are actively using the My Health Record. And as we can see here, there's been more than 96 million Is that working? 96 million pathology reports that have been uploaded to the system. So basically with the My Health Record, there's a view option and also an upload option. So for a provider, they also have two modes of access. There's a national provider portal. This is a view only platform for them to view and download information. In terms of any documents they wish to upload, then they can do that by accessing the My Health Record via a conformant clinical information system. And a list of the conformant systems is available on the My Health Record website. For patients, they also have the option to view their My Health Record through their MyGov account. And this is where they can also upload information, or they can use some apps as well, and that's a view-only platform. Yep. Also, in terms of consent, so a provider is authorized to view and to upload information to a person's My Health Record without having there's sort of standing consent. They don't have to have explicit consent. However, it is best practice if there's any documents that have any sensitive information, it is best practice to ask the patient first. But as well, they are under no obligation to use My Health Record for every single patient they see. It is up to their clinical judgment, and it's case by case. So here we can see all the range of documents that can be found within a person's My Health Record. So the three main sources being the provider documents, this is where the bulk of information will be. And then we have the consumer documents, which I mentioned they enter themselves, and then the Medicare documents. And then what we have in the middle here, these are dynamic views that are automatically generated by the system. So they're not uploaded by any healthcare provider. These overviews pull on information that's already within a person's My Health Record, and they just display the information in one consolidated view within the person's My Health Record. And especially for the pathology reports and diagnostic imaging reports, this can be a great benefit for a healthcare provider, which we'll see shortly. So this is the pathology reports overview function within the person's My Health Record. So here they'll be able to specify a date range, or they can also view tests that have been grouped by date, as well as by the name and the type of test. And they can also sort the results by the organization. So the great thing, again, about having this sort of information all available in that one view, it just saves the healthcare provider having to look at all the different documents separately. And this will then just free up more time during the consultation, so they can just have a more productive discussion with the patient. And within this view, they can then click on the hyperlinks, and then that will take them to the original report, where they can then look into more detail depending on what they're after. So you're keeping in mind there's been over 96 million reports, as we saw previously, that had been uploaded to the person's My Health Record. So also, other than like saving the clinician lots of times, it also reduces the unnecessary requesting of duplicate tests being done, which we know happens a lot now. And in terms of the patient, having access to their results in their My Health Record helps them to track and monitor their own results over time, and really just sort of have a front seat in their own healthcare and just be involved. Okay, so on to the e-requesting or the electronic requesting. So here's a quick look at the e-requesting workflow. So basically, when an e-request, so an e-request being a pathology request that is sent electronically to the pathology lab by the referring provider. So when the e-request is generated, a copy is automatically shared with the laboratory's information system. And at the same time, a paper request will also be printed and given to the patient. So the patient will then need to take this request to the lab, and here the staff will scan the barcode, and this will automatically download the information that's been held within that e-request. So once that's complete, the pathology report and any updates will be sent back to the referring healthcare provider, who will be able to view the report immediately. The only difference for the patient is that the patient will have a 7-day like a lockout period before they can actually view their results, and this is to help give the provider more time to review the results and organize a follow-up appointment. The only exception being for any COVID-19 test results, they will be available for the patient to view as soon as possible, which generally is within 24 hours. So the great thing about having the e-requesting is it will help speed up the delivery of results to the GPs, and it helps streamline the patient experience because there's a faster collection and less waiting, and also really important, lower chance of transcription errors because of the scanning capability. So how can we tell if a pathology request is an electronic request or not? So on the screen, we can see this is what a standard pathology request looks like. So as we can see, it's printed on a piece of paper. We have the patient details as well as the details of the tests that are being ordered. And then the doctor will just sign it at the bottom. So the only difference with the e-request, so here it's the same request, but now we just have this barcode, and this barcode doesn't necessarily have to be in this section, it'll just be anywhere on the form. So this barcode now means that this request can be processed electronically by the lab. So as I mentioned, the form will be given to the patient at the time that it's generated. They will take this to the lab and it'll be scanned. So just that reduced need to manually enter any of the patient details or the test details just again reduces the chance of any errors, and it really helps streamline the workflow for the pathology lab as well. So the form can be taken to any laboratory. The only difference being whether or not these results will be uploaded to the patient's My Health record, which we'll have a look at soon because some do have requirements in place. So the only thing to keep in mind here is if the patient wants to withhold this information from being uploaded to their patient record, and if they explicitly say that, then the provider will need to oblige, and they can do that in a few ways. So they can either check the box that's on the paper there, or there's a box within their software that they can tick, or they can even just write it on the request form, and then that will be communicated to the pathology lab as well, so that they oblige and don't upload that information. So these are some comparisons of the challenges of paper requesting versus the benefits of pathology e-requesting. So where we have private pathology reports available, as I mentioned, there's more efficiency and just a better consumer experience. So especially when it comes to a point of entry into a public or private hospital, usually the first thing they'll do is just order a whole lot of tests, and then it's a matter of waiting for these results before they proceed. But now when they have the staff at the hospital have access to this information, that's already going to work wonders for the patient, especially when it's a time crucial situation, which in a hospital setting can account for a lot of the time. So also in terms of the reduced transcription errors with the e-requesting, so as I mentioned as well, that will just help streamline the workflow for the laboratory. And as we all know, so the idea of changing from old habits, such as the paper requesting, can be assumed to be a bit of a challenge. However, there's actually no change to the doctor's requesting process once they've been set up. So again, no extra time to do these requests. And also with customers that request copies of their results, as they become more aware of the ability to view their results in their My Health record, these requests should reduce over time. And that way, again, no need for the GPs to have to print this out for them when they can access it and monitor their results themselves. Okay, so who is currently connected and uploading pathology reports? So on our website, you'll be able to find a list of pathology providers as well as diagnostic imaging laboratories who are currently uploading to My Health record. So for some laboratories or providers, it's a fairly straightforward process. No extra things or requirements need to be put in place, and they will automatically be uploading a patient's results to a My Health record. There is some cases where there's a bit just a sort of minor extra step that needs to be done, which we'll look at as well. Just keeping in mind as well, a pathology service won't upload a report to a My Health record where there's existing state or territory legislation that prohibits the disclosure of sensitive information without express consent of the patient. So this would be sensitive information, for example, like AIDS or any HIV status tests. So here we can see pathology providers where they have no specific requirements to upload a patient's results to their My Health record. And you can see a more complete list on our website again. So this means that once the consumer takes their request to any one of these organizations, they'll be able to then view their results 7 days after they're ready within their My Health record. And the results will stay in the person's My Health record for as long as it's active, and even for the doctors, unless they were to restrict it, but it's still going to be visible to the patient themselves. So we'll have a look here at, these are the pathology providers that do have requirements in place before they will upload results to a patient's My Health records. So these providers require that the requesting practice is activated for e-requesting with the pathology provider. So this will mean that the practice will need to contact the pathology provider, and they will need to then ask to be enabled for e-requesting. So also the other requirement is that the pathology request must be an e-request, so it must have the barcode on it. And it needs to be generated from a software that's from a compatible version of a software, which we'll also see in the next slide. Keeping in mind also, if a practice wants to refer their patients to more than one pathology provider, they will need to do this for each provider they wish to refer to. So call more than once or twice, depending on how many they want to refer to. Also, some clinics may have been set up for e-requesting in like their software in the past, but if they may never have made contact with the pathology provider, so that would mean that they're not activated yet. So again, that's why they need to make sure they've made that phone call to be activated. If the practice isn't able to refer to a pathology that has the capability to upload to a patient's My Health record, then they can refer them to one of the pathology providers that we just saw that has no requirements in place. Okay, so as I mentioned, so some laboratories have software requirements to enable the practice for e-requesting. So this information is also found on our website. So any practices that use these versions of the clinical information system are able to participate in e-requesting. Any practices that are using software that isn't listed here, it means they can't be enabled for e-requesting yet, but they can still refer the patient to one of the labs that don't have any requirements, and then the patient's results will still be uploaded to the My Health record. Okay, so just to summarize, the steps that need to be done for a practice to be enabled. So as we mentioned before, they need to be using the recent version of the software. For Sonic Healthcare brands, there's just an extra step where the practice needs to perform an individual healthcare identifier validation. And this is by so they need to be connected to the HI service, and they need to make sure they have the 5 key demographic pieces of information for a patient, which will be their Medicare or their DVA card, the full name, gender, and their date of birth. So once that's all done, then the practice will need to appoint someone. So it could be the practice manager or the someone from their IT department. This person would contact the pathology provider to ask to be activated. And again, they'll need to call one or more, depending on how many they want to refer to. And then basically, at this point, they're basically set up for electronic requesting. So then it's just a matter of them making sure that all the pathology requests they issue are actually electronic requests, and that will then enable their patient's results to be available within My Health record. And as for the actual setting up part of it, so it's not like a time-consuming thing. It's just they call up, it's just a phone call, and then all the rest of it happens in the background, and there's no interruption to the workflow of the provider at all. So some clinics might not be aware of which pathology brands are local to them. So we have here a list of the pathology provider contact details that the practice can ring to ask to be activated. Okay, and any other information you want about e-requesting or the list that I showed you about which providers are connected and uploading, this is all available on the My Health record website. For any other information related to digital health tools, you can find that on the Australian Digital Health Agency's website. We also have a helpline. You can reach out at any time for any queries, and we'll get back to you as soon as we can. And also, if you wanted to follow us on any of the social media platforms, you can stay up to date with all the latest that's happening with the digital health tools. Thank you so much.
Perfect. Thank you, Summer, for that great presentation. If you have any questions about anything that Summer's just presented on, please feel free to drop your questions in the Q&A function. in the webinar. So I will now hand over to Sharlene Mellor, who is the Senior Liaison Manager at Douglas Hanly Moir. Thank you, Sharlene.
I'm sorry, some of the information will be duplicated from Semar's beautiful presentation. Sorry. Need to share your screen. Oh, sorry. Okay. So what I'm going through is my health record and processing of e-orders. So the overview, oh, sorry. Okay, so the process summary is the practice requirements, ordering of pathology, the pathology request, pathology collection, the delivery and sample processing, and reporting. And then results viewed in my health record. So as Samar said, the practice requirements to enable the uploading of pathology reports for my health record using e-orders, the practice needs to have established their, IHI service, have e-orders set up in best practice or medical director. Currently for Douglas Hanly Moir, they are the only practice softwares that we are able to upload my health record through, as we're only able to set up e-orders through these systems. And then to advise the pathology laboratory of your intent to upload results to the My Health record. The decision to upload My Health record will be for the entire surgery. Douglas Hanly Moir does not have the ability to exclude individual doctors at this point. To set up e-orders, you need to contact our client IT department, and they're happy to demonstrate and to set up the e-order module for you. Ordering pathology. During the consultation with the patient, a pathology request form is generated through the practice management system. With e-orders activated in the practice management system, the pathology request will now display print/send. Previously, it was only a print option, but with electronic, the results will be sent through the laboratory information service. Pathology request. A hard copy pathology request is generated still, and it will include a barcode and an electronic version of the pathology request, which will be uploaded to the laboratory information system. The patient's IHI is included in the e-order, however, it is not printed on the form and it's not visible in the LIS. This protects patient privacy. Telehealth pathology requests are available for telehealth consultations in e-ordering. We can set up doctors to provide patients with a pathology request via SMS, but you will need to notify the lab for instructions to enable this function. Pathology requests collection. At the collection centre, a patient can present either the request form or their mobile device, which will have the telehealth e-order barcode on it. The collector will scan the unique e-order barcode to initiate the collection process. The pathology request information in the e-order will be transferred to the episode at that time. Delivery and sample processing. After the collection process, specimens will be delivered to our laboratory and testing will be performed and a report will be issued. After testing has been completed, the report will be then transmitted to the referring doctor's PMS. This allows the doctor to review and communicate the pathology reports to their patient. And as Samar said, it will also give time to allow for another appointment. Results viewed in My Health record. 7 days after the report has been transmitted to the referring doctor's PMS, the patient will be able to access their pathology results through the My Health record. So this is what the e-order request screen looks like in best practice. So as you can see, the favourites is now at the top right-hand side of the page. There are several advantages to e-order, not just the ability to upload to My Health record. So there's customised pathology favourites. There is the keyword search for any tests that are not in your favourites on the top right-hand side. This will look at all the tests in the Douglas Hanly Moir database. There's further test information. So under the box of test name, if you hit on further information, that will give you more information about the test. So it will give you any information about a test that has no Medicare rebate on it, but it will also tell you what tube or specimen is needed for that sample. Below that in the clinical notes, we have pre-filled clinical notes. Within these clinical notes, you can tick on some of them, not all, and it will give you recommended tests for that particular medical condition. You can choose to either use all of those or some of those tests recommended. And below that, on the bottom right-hand side, you can also free text a clinical note. You can see on the form too, there is a box that says, do not upload to My Health record. So if the patient does not want those results to go through, you can tick that information and that will come through with the e-order, and the result will not then be uploaded to My Health record. In the clinical notes box, if you type telehealth and have notified the laboratory of your intent, we will send the report, the request, via SMS to the patient. So this is how we enable telehealth referrals. We can also offer e-order in Medical Director. And there are some advantages in Medical Director as well for e-ordering. Within this, there's unlimited favourites in Medical Director. Previously, it was restricted to 10. You can also create patient favourites in this screen. So if a patient has a chronic condition, you can attach the test that you would regularly order to their file. There's also further test information in this system and also telehealth available through there as well. And in the centre middle again, there is do not send reports to My Health record. And the patient has already had that ability to opt out of My Health record if they like. So that was just a short overview of all the things from the side of pathology with the My Health record and e-ordering. Thanks, Aya.
Thank you, Sharlene, for that great presentation. So we do have a few questions, and Sharlene, they are for you. So one is, we are a specialist practice that uses Medical Director, in specific blue chip, can they use e-ordering? Or
Yes,
is this just for GPs?
No, it's not just for GPs. GPs are more likely to use Medical Director or best practice, so that's where we have targeted in the past. But if you are interested, we are definitely able to set you up on Medical Director e-ordering. You'll just need to contact the lab or myself, and we can send one of the liaison managers out and they'll give you a demonstration on how to use it, and then they can set you up as well and include any favourites that you would like.
Yeah, so is this for all of Medical Director, including clinical blue chip? They have Helix as well. Does e-ordering kind of get set up for all of Medical Director's products?
We have been doing it to the cloud-based systems currently, and I believe it has to be Medical Director 3 and forward.
Okay, so that would also include blue chip?
Yes, I believe so.
Okay. Okay, if you have any other questions, we do definitely encourage you to send them through as well. At the moment, I can't see any more questions. We'll probably just give it a couple more minutes for attendees to send those questions through. In the meantime, Sharlene, is there a specific contact number that they can call on?
Yeah, so there
Or-
was on one of the slides. So our client IT department is the best to contact, and they're on 1800 653 779. But alternatively, you can just ring the main laboratory and ask to be put through to client IT.
Okay, great. And is there a liaison manager that comes out to the practice? And
Yeah.
usually,
That's right. So for the Northern Beaches and the North Shore, it would be Shannon Blair. So probably know him. For the specialists, it's Trish Dalpozzo.
okay, great. Thank you. And I believe they can probably find their contact details on the Douglas Hanly Moyers website as well, because I have seen it there. So yeah, they can always head over there and get the details, their contact details.
Absolutely.
Great. Just wait on
was-
any more questions.
I was just going to say as well, if anyone's sort of already had a look around in their clinical software and sort of viewed a pathology report, if they wanted to comment on what they thought of that, if they were able to, if they thought it was quite beneficial, yeah, what they thought of the overview within My Health Record, I'd be keen to know.
Me too. If you would like to comment anything like that, just raise your hand and I can unmute you, and you're welcome to share your feedback. Okay, just another question. Can any of my patients, what was it, retrospect pathology be uploaded?
Do they mean like previous pathology, or can they just clarify? Older
Or
pathology.
older pathology?
I don't believe we can do retrospectively.
Within the My Health Record, it's just the Medicare documents that, so once it's activated, about 2 years worth of Medicare claims can show up, but yeah, not the tests.
Yeah. And there's no way that the GP or specialist can upload those pathology results, well, older pathology results?
I would have to check. I'm not aware of that. Yeah.
Yeah.
If you wanted to pass on details, I could follow it up and get back to you.
Okay. Thanks, Sharlene. Okay, so another question for you, Sharlene. All the questions are for you tonight. Are there any common issues when changing over to e-ordering?
No, there hasn't been in the past. I mean, it's just getting used to things being in a different position. We manage the e-orders too, so there have been instances where they've dropped off, and from the doctor's end, they'll know if the barcode doesn't print on the form, it has dropped off for some reason. But we can fix that up on our end. That's not a problem. But no, it seems to have been a fairly good system. And as Samar said, it does reduce transcription errors because the report is sent to us electronically. We can't view it until that patient's barcode is scanned in the room. So, some people are saying that that we already have the information, but we can't actually access that information until it is activated by the barcode on the form.
And another question is, if I e-order with DHM, but the patient goes to another provider to have their bloods withdrawn or whatnot, will that report still be uploaded to the My Health Record?
No, I don't believe it will. So that barcode is unique to us. So other pathology companies won't be able to scan that barcode. And we've actually had that with some Australian clinical lab requests come through us, and we see the barcode, we try to scan it and it doesn't work. So no, it doesn't work that way.
Great. And will this type of ordering work with Sonic Castlereagh labs?
I don't know from that end. I know that they do have e-order enabled, but I can't speak on their behalf.
Yeah, okay, great. I mean, probably just in terms of telehealth, how does e-ordering kind of facilitate that as well? Is it, you know, do they email the request form to the patient, or does it get?
Yeah, so what happens in telehealth is that once they have e-order on and then they've notified us that telehealth is going to be activated, when they generate an e-order request, they'll type telehealth in the clinical note. We have an arrangement with best practice and medical director that will be sent to us as an email, and then we will do the first stage data entry at our end, and we will send the patient the barcode plus an image of their request form that they can then take to a collection centre. There'll also be a message that Dr. whomever has ordered pathology on them, and then there'll be a link to all of our collection centres that they can go to. So it just comes through to them as an SMS on their phone, but to us, it comes as an email.
Okay, and in that email, it includes the patient's details, such as their email, phone number, which would have come through from the GP.
Exactly.
Okay, great. And they can obviously go to any collection centre and have their bloods withdrawn.
That's correct. There is a little bit of a delay with us being able to enter the results. So if the patient is going to the collection centre in the doctor's surgery within a few minutes, it won't have come through yet. So we have had that happen. But with any e-order at the moment, it will still generate a physical request form. So if the patient is with the doctor and then going to the collection room on site, then they would have the paper report.
Yeah. So the paper will always kind of be involved in this process.
Well, at the moment it is. There's still no option just to send an e-order. The button will still say print and send. Okay.
Yeah. Just had another question. So if there is another COVID outbreak, will there be any way to do this over telehealth? I think
it already is. Yeah. So they can definitely order their request forms through telehealth, and not only do they have to can they use e-order, they can ring us, or they can email us or fax us the request form, and then we'll send a notification to the patient that they can have a COVID test done. Of course, with COVID testing, it's limited to our COVID collection centres or our drive-throughs. They can't go to any of our rooms for a COVID test.
Yeah, great. And are there any plans to have a QR barcode for, you know, pathology request forms like they have with electronic prescriptions?
That hasn't been spoken of yet. I don't think we're at that point.
Yeah.
But
I mean, that would
certainly know QRs now, so
be a game changer.
Yeah, exactly.
And do patients ever notice any difference?
Yes, they do, because when it's an e-order request and the rooms scan the barcode, if a patient has been and had pathology in the past, they'll notice some differences. So on the collector's screen, it will come up with the details. In the past, the collector has just asked the patient to spell their name, surname, give their address and so forth, but they can refer to the screen to get the patient to confirm that they're the details. Also, our collectors used to have to write all the details of the patient on the tube. With e-order, once they scan it and do the collection, it will generate barcodes with the patient details that they stick on the form. They're the only differences, but it actually makes it a quicker process for the patient. So there is an advantage to us and to the patients in our rooms when a doctor uses e-order.
Okay, don't see any more questions come through. We just give it a couple more minutes. another question's come through, and I think it was addressed in the presentation, if the patient's IHI number is printed on the e-order.
The patient's IHI doesn't get printed on the form. It's encrypted in the barcode. So so we cannot see a patient's IHI.
Yeah. And I believe it could be because it's a unique number that kind of identifies every patient, similar to your HPAI number and your HPIO number. They are unique identifiers. So something like that probably would be shared on a piece of paper.
Same with the electronic prescriptions, there's always very limited information associated with the barcodes, like Sharlene said, for confidentiality.
And I think just moving on to clinical software and setup for e-ordering, are there any plans for Genie software to become conformant with e-ordering?
Yes, Genie is our next project. So we have been working on Genie for a while, and we're quite excited because that will open it to a lot more specialists.
Absolutely. Especially for specialists who, deal with chronic patients. You could imagine what it'd be like at the collection centres. I think e-ordering would definitely facilitate a much faster collection time
and also because we can set up favourites. I'm not sure about Genie, but with Medical Director, we can set up patients for favourites for a particular patient. So, if that patient has the same tests every time they come in, it's a much quicker process for the doctor to just click on the favourites that they've ordered in the past for that condition.
Absolutely. Okay, and with the Sonic portal, we can log in and see pathology results. Will there be any changes if we're using e-ordering?
No, definitely not. It's still exactly the same. So Sonic DX is what I think they're addressing, and that portal is still available, and we're continuing to develop that portal because it's been very popular.
Great. And will the system eliminate patient mismatches? It's another question that's come through.
In a perfect world, but there's always, it still doesn't completely eliminate human involvement, and so there is sometimes still the ability to click on the wrong match.
Yeah.
But we aim to do everything we can to reduce that happening.
Okay, I can't see any more questions come through, all really good questions, which is great. So I guess if there's no more questions, just want to thank Sharlene and Summer for their really great presentations tonight. If you have any questions, please feel free to reach out either to myself or to the Australian Digital Health Agency. I can also put you in contact with any of the presenters tonight. So if you want to get your practice set up with pathology e-ordering, please feel free to reach out either to your liaison manager, or you can contact the digital health team at Sydney North Health Network. If you would like to get your practice connected to the My Health record, we can also certainly help you with that. Just reach out and we can support you with that as well. So just before I do end the webinar, just a friendly reminder to please complete the short evaluation survey, which will pop up on your screen at the end of this webinar, as your feedback is really important to us. So if there are no further questions, I can't see anything come through. I will end the webinar now, and just like to thank you all for joining us tonight, and to have a good night and stay safe. Thank you.
Thanks, Anne.
Thank you.